Hey everybody, it's Marlon. Welcome to the show, Chronic Pain Warriors United. I hope that y'all are all having a great Wednesday afternoon, morning, uh, evening, whenever you happen to see this. I originally made this video once already, but I'm doing it again because I didn't like the quality. The the lighting was not very good. It was at night, and I had the whiteboard. Blah blah blah. Anyways, we're doing this again. So the DEA first really started interfering in our lives and into our uh, medical lives, especially our primary doctors and things like that, all the way back in 2006, 2007, when they started sending out memos saying, hey guys, we think that y'all may be prescribing too many opioids. This is putting y'all sort of on notice. We want y'all to back it up. And some may have, some may have not. I don't know. I personally remember that at that point in time, getting opioids for actual painful issues was not that hard. I mean, it was still pretty easy. I was 18 in 2008. So, um, in 2016, that is when things really, really, really changed. The whole thing changed, and it was because in July of 2016, Barack Obama signed the Comprehensive Addiction and Recovery Act. 2016, we get the Comprehensive Addiction Recovery Act, and it gives the DEA and government broad powers to deal with the epidemic as they see fit. And one of the main things that they saw fit to do was start to order the pharmaceutical industry to cut prescription opioid pharmaceutical production by massive numbers. The first year across the board, it was something like 26%, 27%. And it went like that for years, right? All the way up till 2020. And then we had COVID. COVID happened in the middle of this, and it made this whole situation that much worse. So, 2016, the Comprehensive Addiction and Recovery Act gets signed into law. The DEA starts going to our primary care physicians and saying, we don't want you to be giving the level of pain management to your patients as you are. We want you to only be writing X number of scripts per quarter, month, whatever, and you cannot go over that. If you do, we'll be investigating, we'll hound you, and you'll spend 6 months, a year, 2 years trying to defend your license and may wind up having to quit anyways. They did that to several doctors here where I live in Birmingham. A couple of them were cleared, but the point, I think, was just what they call the chilling factor. It's just to have an effect on the other doctors, and it absolutely did. So that's 2016, and that is when we're going to start with. On 2016, right here, the government statistics claim that we had 41,000 opioid-related overdose deaths, right? And this is the start of all of this. They order massive cuts to pills being made. This is how they are intending to stop pill diversion. In 2017, overdose deaths go up. Now, I want everybody to remember as we go through this, everything that they did to interfere with our medical system. Oh, and by the way, this cost $180 billion. So everything they did from 2016 on is supposed to be stopping the opioid crisis and reversing the opioid overdose deaths. 2016, we start at 41,000. They start enacting all of this policy-wise. 2017, we're already going up. It's at 47,000. And people like me screamed when they first said they were going to do this, don't. And only 2 of our senators, ladies and gentlemen, actually stood against this insanity. Ben Sass and Mike from Utah. 2 out of 100, or 99, I guess you say. 2018, growing up, 49,000 opioid-related overdose deaths. 2019, huge jump all the way up to 57,000. We're starting to see the beginnings of COVID. 2020, here we go. COVID, ladies and gentlemen, it hits in all of its ridiculousness and inanity and all the problems it caused. We skyrocket from 57,000 to 69,000 opioid overdose deaths. In just 4 years, we've gone from 41,000 to over 67,000. And everything the DEA is doing is harming patient care. It is making it almost impossible for chronic pain patients to find effective pain management. It is causing others who have lost hope of doing so completely to take and end their own lives any way they figure out or want to. And the people who take an exit out of this life of their own choice are not counted in these numbers. These numbers, I guarantee, are low, ladies and gentlemen. So we get to 2020 and we're already up to 69,000. And the whole time they are issuing orders to the pharmaceutical industry to continue cutting the production of opioid pills. Remember, this is all to stop the diversion of opioids and to stop the overdose deaths. 2021, massive spike again, all the way up to 81,000. Ladies and gentlemen, pills have not been killing people from all the way back down to here. Opioid-related pharmaceutical pill deaths are all but eliminated. Anybody who was trying to self-medicate and deal with the black market at the time knows that the first time and the only thing the DEA has ever succeeded at was stopping the diversion of pills, and it was because they were dealing with law-abiding citizens. Americans, doctors, patients, citizens. When it came to the fentanyl and to the heroin and to the CARA fentanyl and the opium and the benzodiazepines laced intentionally or not with fentanyl that came flooding across the border, they were not dealing with law-abiding citizens. Once again, they were dealing with the people they were created to deal with, the criminals and the cartels. And once again, they failed, like they have failed at every other thing they have ever tried to do that did not involve law-abiding Americans. 2021, we're already up to 81,000. 2022, 85,000 opioid-related overdose deaths, with them saying in the statistics that over 78,000 of those were synthetic opioid-related deaths, meaning fentanyl or heroin or some other illicitly made substance. Opioid pill overdoses from pharmaceutical pills is all but a thing of the past. It is dead. It has not been happening for years at this point. And yet, the overdose deaths skyrocketed, exactly as we said they would, because you took who knows how many millions of people off of a stable system that worked for them, and you threw them into a system that many could not deal with. Either they could not afford to get into pain clinics, couldn't afford to deal with the doctors, didn't have insurance, which precludes you from being treated by many pain clinics. I mean, the list for reasons that people could not get through to these things is massive. Not to mention the barriers themselves to getting the medications once you actually may actually get in to have a consult with one of these pain doctors. The hoops you have to be ready to jump through, and most of the time have already jumped through to even get a consultation now, is incredibly intense. So all of that, opioid pill, pharmaceutical pill deaths are not happening over here. They weren't even happening really at this point down here. There were some, but not many. The vast majority is from illicit substances that the DEA forced Americans into a black market system to try and self-medicate, and the deaths have been staggering. And this is not even close to all of them. I promise there are a lot more. And here we are for 2023, the last year that we have any reliable data, and this is still relative. They are not done collecting data for this yet, but right now it sits at 82,000. They're claiming right now the first time it has dropped in well over a decade. And it's not the case. That is not going to stay like that. It will be revised up. This is absolute insanity, ladies and gentlemen. So that 2016 is when that started. Excuse me just a second. And here we are in 2024, and every one of us chronic pain patients, chronic pain sufferers knows that the issue has gotten no better. It is harder today for a chronic pain suffering individual to get into a doctor and have his or her pain treated than ever before. It is more onerous, more expensive, and more complicated than ever. And after all this effort, all the work that the DEA did to do this, like I said, this cost $180 billion. And we wound up from 2016 to 2023 with 511,000 overdose deaths that the United States government is acknowledging. There were more, many more, whether through comorbidities, whether people just never knew, whether toxicology or testing was not done at time of death, whether it was an act that they chose to do themselves and was not looked further into. There are a lot more than this, both from opioids, unintentional overdoses, people trying to self-medicate, and the medication, the fentanyl, heroin, or whatever they got wound up being too strong, or it wound up being tainted, which is the latter is what happened to me. When I was having to try and self-medicate in this system from the time I was 23-ish all the way to early 30s, I had nothing but doctors tell me I was too young to go on to opioid management. They were like, maybe in your 30s. And most of the time I'm thinking, can I at least, get to my 30s and then we can maybe think about my 40s. I'm not even sure I'm going to make it to my 30s the way everything feels and how everything takes its toll. It took years, ladies and gentlemen. And if I had not chosen to self-medicate during that time, my mental health would have declined to a position where I cannot say that I would be here today. I just can't. And it would have been, and even with all that, what wound up happening to me was I got tainted drugs, medications, pills. To this day, we don't know what was in them. They gave me massive seizures that almost killed me. I woke up 2.5 days later in the neurological ICU unit at a local hospital. And to this day, I used to have a very nearly eidetic memory. And to this day, that eidetic memory no longer exists. My short-term memory has been damaged from that encounter. And that's another thing that's not included in here. The deaths, yes, but what about the people injured? Like me, like you, like many of you, I'm sure. What about people injured to a degree that it has irrevocably changed their lives? There's many, many, many more of those. This is an absolute travesty, ladies and gentlemen. This breaks my heart into a million pieces. We're starting to run now, so I'm going to go ahead and finish this up. The DEA said that everything that they were doing from here to here was to stop opioid-related overdose deaths, to fight the opioid crisis. And they failed in such a magnificent fashion that to the tune of over 500,000 acknowledged Americans dead. We have to change this. This has to stop, ladies and gentlemen. Please get up there, hit that subscribe button, get down into the comments and let us hear your story. Tell us how this affected you, how you went from point A to point B to point C, how difficult it has been for you to find effective pain management. These issues and your stories, everybody, are so important. Just like you are an amazing, special, truly gifted individual, so are your stories. They are part of you, and we really would love to hear them, and we need them, because they are going to be a big piece of what pushes this movement forward. So get down there, hit that like button, get in the comments and let us know, and hit that subscribe button. I'm Marlon with Chronic Pain Warriors United. We're calling on the DEA to account for this. We won't comment from the DEA on this. Chronic Pain Warriors United demands that the DEA, what does the DEA have to say about this? I want an answer. Tell them. Get on X, Facebook. Tell them you want an answer. I'm Marlon. We'll be back soon.